Welcome to our video on loop diuretics. In this presentation, we will explore loop diuretics, including their mechanism of action, indications, pharmacokinetics, adverse effects, and contraindications. Loop diuretics are a class of medications known for their potent diuretic effects. Common examples of loop diuretics include furosemide brand name Lasix, bumetanide brand name Bumex, and torsemide brand name Demodex. Loop diuretics primarily act on the loop of Henle in the kidneys. Their mechanism of action involves inhibition of sodium reabsorption. Loop diuretics block the sodium-potassium chloride cotransporter in the thick ascending limb of the loop of Henle. Loop diuretics are used to manage various medical conditions, including, number 1, congestive heart failure. Loop diuretics help reduce fluid overload in congestive heart failure patients, relieving symptoms like edema and shortness of breath. Number 2, hypertension. They can be used in combination with other antihypertensive drugs to lower blood pressure in patients with uncontrolled hypertension. Number 3, renal conditions. Loop diuretics are valuable in acute kidney injury and nephrotic syndrome when there is a need to eliminate excess fluid. Understanding the pharmacokinetics of loop diuretics is essential for their proper use. We look at their absorption, distribution, metabolism, and excretion. Regarding absorption, loop diuretics are typically administered orally, intravenously, or intramuscularly. They have good oral bioavailability with rapid onset of action when administered intravenously. Distribution. These drugs are widely distributed in the body but primarily target the renal tubules. And lastly, metabolism and elimination. Loop diuretics are minimally metabolized and are primarily excreted and changed by the kidneys. Loop diuretics can cause adverse effects that should be closely monitored. These include electrolyte imbalance. These drugs can lead to imbalances in potassium, sodium, and magnesium, potentially causing muscle weakness, cardiac arrhythmias, and cramps. Dehydration. Excessive diuresis may lead to dehydration, resulting in symptoms such as thirst, dry mouth, and low blood pressure. Ototoxicity. Some loop diuretics, like furosemide, may cause hearing loss, especially with rapid intravenous administration. Loop diuretics should be avoided or used cautiously in specific situations like hypersensitivity. Patients with known hypersensitivity or allergies to loop diuretics should not take them. Anuria. These drugs are contraindicated in patients with anuria, a condition characterized by the absence of urine production. And lastly, severe electrolyte imbalances. Loop diuretics are not recommended for individuals with severe pre-existing electrolyte imbalances. That's all we have for you today. Thank you for watching this video and see you next time.